Assalamu alaikum, everyone, and welcome to another episode of Community Health Series. And today, our topic is to prepare you to fast during Ramadan, especially if you have diabetes. So, I would like to welcome Dr. Balal Lone. So, our special guest today is a family physician and a sports med physician practicing in Hamilton, Ontario. He finished his medical degree and family medicine residency and sports medicine fellowship all at McMaster University. He's developed a keen interest in diabetes after learning of close family members being diagnosed with diabetes. His interest grew further when he worked in diabetes clinics during Ramadan in his second year of medical school. Since then, Dr. Balal Lone has been passionate about helping patients and healthcare professionals learn about how to safely and effectively allow patients to fast during the blessed month of Ramadan. So thank you so much for being here and welcome.
Assalamu alaikum. Thank you for having me.
Okay, so I guess let's kind of get started. So let's say you've been recently diagnosed with diabetes, or you've had it for so long, and you didn't even realize that fasting could be something you have to think about in terms of medication adjustments and things like that. So, how do you plan for diabetes?
It's interesting, and this is something that hadn't even crossed my mind actually until I was actually in that diabetes clinic during Ramadan that one year. And so really, when it comes to planning for Ramadan as a person who has diabetes, it's very important to discuss with your doctor if you're planning to fast. There may be medication changes that need to be made. You need to know when to break the fast, or when it's indicated to break the fast. And even if you are able to fast, it's important to discuss with your doctor, because there's just certain things that you need to go over and be aware of. I will say, in the Quran, it's mentioned that if you have an illness, it's not mandatory for you to fast. So if there's a detriment to your health, or if there's a risk to your health, it's not mandatory for you to fast. So when you're planning for Ramadan with diabetes, ideally you see your doctor about 2 to 3 months in advance, and then you discuss the safety of fasting. Is it safe for me to fast? You identify the risks of fasting. What could go wrong, and along with that, when should I break my fast, or when should I be advised to break my fast? You might need to change your your medications that you're taking, and might need to change some things in the lifestyle. And we'll talk about dietary advice. We'll talk about exercise and those kind of things. And again, like I said, very important is the red flags. When do we need to advise patients to break their fast and to discontinue their fast?
No, so that's great. So you're saying 2 to 3 months, that's now, right? Ramadan's coming in April, and hopefully it's been since January that everyone's planning. And we're just, a month away. Anyone who has diabetes and you're planning to fast, you have to talk to your doctor to find out if it's safe or not. So that's great. So what is the ideal patient who can fast? Who might be able to fast, just from the get-go?
Yeah, so the ideal patient is ideally, like, the green zone, we would call it, is somebody who has well-controlled diabetes. Somebody who's either controlled with just without medications, just based on their lifestyle, based on their diet alone. There are certain medications that lend themselves better to fasting. These are the medications typically that don't cause people to get hypoglycemic as readily. So these are medications like metformin, a DPP-4 inhibitor I won't get into, but like sitagliptin or Januvia is the commonly used name for it. So that's kind of your green zone person, somebody who is the ideal patient, whose blood sugars are well controlled. They have a low risk of getting a low blood sugar, or hypoglycemia as we call it, and is otherwise healthy. The yellow zone, these are high risk people. Sorry, can we just go back to that to again? The yellow zone, the high risk people, the higher risk people, I should say, are they have type 2 diabetes with sustained poor glycemic control. So ideally, your hemoglobin A1C should be less than 7%. People who have poor glycemic control, so I would probably say 8.5 or above, or people who have well-controlled diabetes, but they're on multiple daily insulin or on mixed insulins. Pregnant females with diabetes, stage 3 kidney disease, somebody who's going to be performing intense labor. These are all people who should take caution when they're considering fasting. And a well-controlled type 1 diabetic as well would fall under this category. And then there's also the category of people who are kind of the red zone and who absolutely should not fast. And these are people who have poorly controlled type 1 diabetes, so an A1C 8.5 or 9% or higher. People who've had a
That's
severe,
really high. Yeah.
I'm sorry?
I'm saying, yeah, that's really low.
Yeah,
Really hope
sorry.
you're seeing your doctor anyways.
Yeah, exactly. And then, I mean, if they have a severely low blood sugar level within the 3 months preceding Ramadan, somebody who has recurrent low blood sugars or who is just unaware when their blood sugar levels go low, or the converse is also true. If somebody goes into a hyperglycemic coma, their blood sugars go so high that they end up having to be hospitalized. And those with advanced complications like advanced kidney disease, cognitive dysfunction like Alzheimer's dementia, uncontrolled diabetes. These are all people who should not fast.
Okay. So I guess to summarize it from what I'm understanding is if you're on just pills, or first of all, if you're just diet controlled, great, you can probably just fast. If you're on pills, it depends on which pills they are. If they're the ones where you don't have a risk of dipping down to be too low, then you're probably safe. And even there's the caveat of how well controlled your sugars are. If it's not that well controlled, even these factors are not enough. So you have to speak to your doctor. And when you're getting into insulin or type 1 diabetes or anything that really can cause hypoglycemia, you have to talk to your doctor if it's even safe for you to do it. Okay, so that's great. And you guys can pause these screens and take screenshots and talk to your doctors too for the viewers out there. Yes, you were saying?
I was just going to add, if you fall into the yellow zone category, somebody who's at the higher risk, it's still possible to fast. It's just you should have closer follow-up during Ramadan. And the studies show that if you have close follow-up with your doctor during Ramadan, you have less risk of complications. So just, again, be in the know with your doctor, make sure you're in touch. I think the number one issue that comes up is that people try to fast without engaging their doctors, and then they run into complications.
Yeah, and I guess the big reason is a lot of these meds can be adjusted for the fasting period, right?
Exactly.
So, don't try to take this on your own and say, I'll monitor it, I'll check my sugars, but no, there could be easy changes to your regimen. So definitely speak to your doctor. So I want to talk about some myths super quickly. So, I have a lot of people who come and they might say, let's talk about monitoring our sugars while fasting. People are worried that pricking their skin will break their fast. Is that true?
So I looked into this, and I mean, from everything I could find, it's kind of unanimous across the religious authorities. Scholars say that skin pricking does not invalidate your fast. So checking your blood sugar levels, whether it's by those continuous glucose monitors or using the common skin pricking and then checking your sugars with the glucometer, does not invalidate your fast. You can also speak to your local imam to ask, but my understanding is that it does not.
Yeah, that's exactly. I think last year we had an imam come in and he said the same thing. So definitely a big one that we want people to overcome. And then something else about, some people are like, if I check it and it's too high or too low, then I'm just gonna have to break my fast. So I'm just not gonna, ignorance is bliss. What are your thoughts on that?
Yeah, I think it's important to note that, again, hypoglycemia, or like when your blood sugar levels dip so low or when your blood sugar levels go so high, it can be a life-threatening issue, right? And so harming yourself in the process of fasting is discouraged. At the end of the day, sanctity of life and sanctity of your body is key, and so you don't want to harm yourself. And so it's important to make sure if you feel unwell, that you always check your blood sugar levels.
So I guess that brings us to how often and when should people check it? So I guess unwell, what are you kind of referring to? And how often should I check it if I'm fasting with these meds?
Yeah, so if you're generally well controlled, you don't need to check often. Like, you can check once, like upon waking up after suhoor, like in the hours afterwards, and you can check again if you feel unwell during the day. But generally, people who are well controlled or on oral medications don't really need to check. If you're on insulin or if you're a type 1 diabetic, you do need to be checking more frequently. So it's generally at suhoor time, then when you wake up, and then every 2 to 4 hours afterwards, make sure you're checking your sugars. And then obviously if you feel unwell. So by unwell, for example, if you have a day where you're vomiting or you feel lightheaded,
Mhm.
you have diarrhea, any of those kind of things, those are days that we would generally recommend people not to fast on those days and make up those days later. And the reason is because the risk of the emergencies is higher on those days. The way your medications interact, and you're going to be fasting, you might be dehydrated. All these things contribute to your risks being higher.
So what are some of the emergencies that people can see
For sure. So
and
I
when
mean,
should they break their fast, essentially?
for sure. Yeah. So the three main reasons you would want to break your fast is if you have low blood sugar levels. So this is a blood sugar less than 4 millimoles per liter. And if that happens, or you feel like your sugars are low, you might feel like your heart's racing. You might feel like you feel nauseous. You feel shaky. Break your fast. It's very important to do so. Break your fast with a small amount of something sweet. So a date, it can be a small carton of apple juice, and then retest your blood sugars after about 15 minutes and keep doing that process until your sugars are above 4. And then you can make up that fast at a later date. The opposite is also true, hyperglycemia. So if your sugar exceeds, depending on where you look, but if it's high, above 14 or 16, and you get symptoms, so you feel nauseous, you feel pain in your stomach, you feel confused, sudden increased hunger, need to go to the bathroom constantly. Again, this is an emergency. You need to go to the hospital, i.e., like go to the emergency room and discontinue your fast. And then the final one, like I said, dehydration. So your heart might be racing, you're sweating, you're extremely thirsty, you're not peeing as much, and you feel lightheaded. This is again an indication to break the fast. Drink water, add some sugary solution or salty solution. So take like a sports drink like Gatorade or Powerade, and make sure you don't take
Mhm.
your oral diabetic medications for that day.
I'm so glad you touched on this. I've had already two occasions where I've been at the mosque before the pandemic, and I've had people faint. And one of
Mhm.
them turned out wasn't taking, they stopped all diabetes medications,
Mhm.
and it was actually, and then fainted. And so, our body is an amana, right? So we still have to take care of our body, and Allah has ways for us to make up fasts.
Mhm.
So important to not put our body to a point of being hospitalized or getting into such an emergency situation, because it shouldn't be that hard, right? So I
Exactly.
love that you touched on all these emergencies. um, and then something else that I think a lot of people aren't aware of is a sick day medication list. Like oftentimes that gets overlooked, and that's applicable to diabetic patients, people with just high blood pressure and nothing else, or even just kidney issues and nothing else. They're on certain medications that they should be aware of. Can you touch a bit on that?
For sure. So these are medications that typically affect your kidneys, and you want to make sure you're drinking enough fluids. And so during Ramadan, like these medications can be altered so they're taken at iftar time. But again, if you've vomited or if you've had a prolonged course of diarrhea, or if you're losing fluids in your body and you can't replenish it, you should stop these medications for the day. So ACE inhibitors, something like ramipril or perindopril. These are
Oh, the
common
Pril,
medications.
yeah.
The pril medications, exactly, that you would use for blood pressure. Metformin's a commonly used diabetic medication that you would have to stop. The angiotensin receptor blockers. Why am I blanking right now?
The
Like
Artan.
telmisartan, valsartan, yeah, exactly. These kind of medications. Anti-inflammatory medications we commonly use for aches and pains, like Advil, Aleve, these kind of things. And then the newer medications, like the SGLT2 inhibitors, like Jardiance, um, Invokana, these kind
Lithium,
of
basically.
medications.
Yeah.
Exactly.
Yeah, no, that's awesome. And then the other one that I hope no one's on is dimicron or those sulfonylureas, because we have so many
Yes.
new medications these days that are so much safer, um,
Mhm.
whether you're in Ramadan or not. So yeah, those are other ones.
It's an often forgotten one off that list because it's an older medication.
Yeah. So if you're on that, talk to your doctor anyways. No, that's great. Okay, so let's say you've we're not having any emergencies or anything, but we want to have a healthy preventative lifestyle. There's all these intermittent fasting, keto diets, people are fasting all the time. So how do we optimize Ramadan so that we're being healthy? Like, what are some of the things to keep in mind for exercise, let's say?
For sure. I mean, so it's still recommended to exercise, but the timing and being aware of your body is important, right? It's Ramadan's not the time to get jacked. It's not the time to start like your intense physical training. Keep in mind also, even going to Tarawih prayer counts, and doing your daily prayers counts as exercise. It's amazing. But when it comes to exercise in general, you want to perform regular, light, moderate exercise, 15 to 30 minutes a day. You want to avoid aggressive, high intensity exercise during the daytime when you're fasting, especially true when we were in the summer months when we had such long fasts. You can exercise just prior to iftar, but if you're going to do that, make sure it's limited and no longer than 60 minutes. The ideal time would be 2 to 3 hours after iftar. Don't do it in the middle of the day, like 1 p.m. and then you use all your energy and then you still have to go the rest of the day fasting. When it comes to physical activity, it's very important to stop if you feel dizzy, nauseous, you have difficulty breathing, or have chest pain, and you want to make sure that between iftar and suhoor you're drinking enough water to avoid dehydration during the next day's fast.
That's perfect. And how about food? I know when we break our fast, we have all these fried, delicious food that I'm looking forward to but scared of. What do we do about that?
Yeah, so it's nice, right? Like Ramadan's a beautiful time of the year. We get to pre-pandemic got to get together with family and friends, and it's a feasting kind of environment. And so we end up eating large carbohydrate heavy meals. There's a lot of sugary treats and drinks, and all of these, for somebody who has diabetes, it can impact you quite negatively, right? I remember once a few years ago, I came across an article from one of the Middle Eastern countries where hyperglycemia was at its all-time high during Ramadan because people were getting admitted with high blood sugars because of what they were consuming for iftar. And so you want to avoid these amazing foods that are on on the slide right now. I won't say avoid them completely, but I would say everything in moderation, right? So it's very easy to eat like one samosa and then you go for your second, third. Next thing you know, you're at your fifth one. Keep it moderated, and the same goes for the sugary drinks. Everything in moderation is okay, but how can we really balance it out, and how can we really balance our meals? First of all, especially for people with diabetes, the biggest thing, and this seems common sense, but the biggest thing is make sure you wake up and you have suhoor. A lot of people skip it, but you want to make sure you eat the morning meal, right? And you want to make sure it's a balanced meal. You want to eat slow release carbohydrates. You don't want to eat like jam on white bread and call it a day. You want to make sure you're eating something that's going to last you for the day. So things like steel cut oats or nut butter, beans. If you're going to eat rice, whole grain is better. Adding in protein, yogurt, maybe a cup of milk, cheese, all these kind of things would be helpful. You want to avoid or limit sugary foods and fatty foods, like I already mentioned. And another important thing is avoiding like gorging and overconsumption. It's not good for your blood sugar levels, and it kind of goes against the whole spirit of Ramadan as well. And then limiting your caffeinated beverage intake as well. Caffeine is a diuretic. It'll push fluids out of your body. It'll make you dehydrated. So try to limit that as much as possible. Make sure you're keeping yourself hydrated. The other thing would be avoiding processed foods and salty foods as much as possible. And then desserts again, right? You want to make sure you're not eating too much dessert. There's an abundance of it during Ramadan, even more of it during Eid time. So you just want to make sure you're keeping it within moderation. And then again, like I said, making sure you're well hydrated throughout.
I like this chart that's being posted here. I think, can you talk a little bit about like why it's so important to avoid those sugar spikes? Like, what does it do to the body?
Yeah, so what it does is it suddenly so with diabetes, essentially what happens is you have too much sugar in your body to begin with. And so the medications you're taking, the exercise, everything you're doing is to try to limit that amount of sugar that's in your body. So when you're eating these sugary foods or these very sweet things, your body's sugar levels suddenly spike up, and really your body is already not adept at handling that amount of sugar spike. And then when it does spike up, the insulin is not able to work as effectively to put the sugar into your muscles and other cells that may take it up. So, when you eat something that's like whole grain or something that's more fibrous, it does a more modest rise in your blood sugar levels, and it doesn't make you feel as bad when the sugar comes down in your body.
So essentially, don't stress your body with big chunks. Try to, that's why Islam says everything in moderation,
Exactly.
which you were talking about. So it's like a broken record of the same thing, no matter what illness, right? At the end of
Exactly.
okay, so oftentimes this is a great time if there's any live viewers here. If you have specific questions about your medications, you can let us know. But otherwise, I might, give you maybe a bit of a case. So, I've had a patient who is on metformin, which is kind of the common one most people are on, and they're on Jardiance, which is, the gliptins. Sorry, is it gliptin? No, it's a Flozin, right? So
Frozen.
these medications that are newer, which are great at lowering your sugars, it can also bring your blood pressure down. And they're wondering, should they time it differently? If they can't, like, should they have it at suhoor or iftar? Is there a timing for the medications?
You really don't, when it comes to metformin and when it comes to the Flozins, like the newer medications, like that drug class, you don't really need to change the medication. Some of the older recommendations did mention to switch the timing of metformin or split the dose. So you take a smaller dose at suhoor time, and then you take the full dose at iftar. But really, the newer guidelines for diabetes and Ramadan say you don't need to change it for those
Okay, great.
medications.
How about people with type 1 diabetes? I mean, they're by default on insulin. Anything specific for their regimens?
Yeah, so I mean, with type 1 diabetes, you want to make sure, first of all, they're higher risk to begin with, so you need to make sure they're monitored regularly. But you want to make sure they're on like a longer acting basal insulin, so something like Lantus or even the newer ones like Tresiba or something like that. You want to make sure that you reduce the dose as well. So I think it's 15 to 20% is the reduction in the basal insulin, and same for the what's it called, for the pre-dawn meal. So you would reduce it about 25% for the suhoor meal as well.
Okay, perfect. So again, for viewers, this is why it's so important to speak to your doctor, because it's very specific to you and what medications you're taking. And what if their family doctor doesn't have much knowledge on how to tweak these meds? What's a resource patients can show their doctor so that the doctor can then adjust based on that?
For sure. So the Canadian Diabetes Association actually has a Ramadan and diabetes position statement that they put out. I think it was 2018, but it's readily available. Any doctor can, or anybody can really access it by going online and looking it up. It's great resources for the physician to have, and it goes through all the medications in detail.
Perfect. Okay. So there's really no excuse for these doctors not to know it if at least you give it to them. It's fair for some doctors not to have enough exposure, and so it's kind of our job to help our viewers empower themselves and take control of your health and cater to your needs by kind of knowing how to navigate these obstacles. And hopefully, Balal and I will put something together on the muslimmeds.ca website. And that could be a good resource as well. So those are, I think, the big questions I have. Are there any last words that you want to mention, things that you'd love your patients or family members to know?
Nothing comes to top of mind. I think, like we mentioned, just make sure you're involving your healthcare professional, you're involving your doctor on this, whether it's your endocrinologist or your family doctor, or whoever your diabetes education center may be. Just make sure you're involving them and letting them know that you're fasting. I think as a physician, I appreciate knowing why patients aren't doing a certain thing. So, I mean, oftentimes people will just not take their medication, and once you ask them why, it's like, oh, I was doing something, or I was trying to figure this out, and there might be a knowledge gap, or it's a chance to have a conversation. It's our job as providers to not judge and to help either clear up any misconceptions or to help our patients with what they're doing. So although even patients who may be at high risk, these guidelines are there to help us as providers help our patients do so safely if they do choose to fast. So I would encourage everybody to talk to their doctors and discuss whatever medication changes or whatever changes need to be made for you to be able to fast safely.
Perfect. So I guess the steps are: talk to your doctor now, and if you are able to go back in time and do it 2 months ago, and make the right changes, and don't feel guilty if your doctor says it's not safe for you to fast. It is, our religion has prescribed it, but it has also prescribed for you to protect your body, and we have alternatives. So if your doctor says it is not safe for you, then that is a reason to really not push it, because you need to be able to survive, to do ibadah, and to do everything else that Allah has prescribed as well. And yeah, with that, thank you so much, Balal, for being here and for working on this. And I know we work together on this topic as well, so I look forward to putting together a resource with you for our viewers, so that if your doctors don't know, you can show it, and they can hopefully tweak things from there. That's it. So stay tuned, keep watching our community health series, and like, subscribe, comment, and show us and let us know of what other topics you want to know about. Thank you so much, Dr. Lone, for being here with us today.
Perfect. Jazakallah khair for having me.
All right.